What do you think separates somebody who's confident from somebody who's leading with their ego?
That's a great question. So if you're leading with your ego, then your primary motivator is yourself, right? Your primary motivator is you. And that is very evident to anybody who's around you trying to follow you, right? Trying to do what's best. When you're leading with confidence because you know and understand what's happening and you know and understand where your goals are, where your team is going and what you're trying to do, I think that changes the entire team's mentality, right? Because you're not going to find a bunch of team members who are loyal and willing to follow you if you're doing everything for yourself. Mm-hmm. You will find a team will follow you, and confidence, well, frankly, confidence is contagious, right? If they believe that you believe that in the goal and the activities, and you believe that you can set yourself apart, mm-hmm. Not just yourself as the leader, but your team to confidently accomplish your goal, then I think you're great. But for me, confidence is that ability to have a confidence and a positivity and an ability to know that we can reach our goal no matter what comes and what gets in our way. That becomes contagious for everybody on your team.
So it sounds like ego is self-driven, but confidence is internally driven because you want to do what's right.
Correct.
You want to do what's on best, and that you know that you can contribute to that in that mm-hmm. way. Confidence comes from understanding, a lot of training, a lot of hours spent.
Experience, yep.
Experience, and then it has nothing to do with furthering your own agenda.
Correct.
Or padding your wallet necessarily.
Also
or anything
true.
Like that. It's not what leads you.
Correct. 100%.
Yeah,
I agree
and
with
accolades that. Also not necessarily part of that.
Accolades not necessarily part of it.
Gotcha.
Okay. I would say not part of it at all, right?
Yeah. If you're doing it for that, you're in the wrong sphere.
And it is very difficult. It's very difficult to get people to follow if you're not confident. Mm-hmm. I think it may even be more difficult if they know that your only motivation is yourself. Mm-hmm. Right?
Yeah.
If you're arrogant, then people will back away in the moments when you need them the most. They will back away from you. Mm-hmm. If you're confident, then people will be confident with you and move forward, even when things are really challenging.
Well, and I would say also, like, especially in our profession, confidence attracts a good team, right? Right. You're talking about people who would want to follow you, and that's 100% right. Nobody wants to be stuck in the room with the person who simple, lap appy routinely is taking them 3 to 4 hours because of the lack of confidence, lack of experience, and they don't necessarily want to be in that room. People are like drawing straws to try to not be in that case, unless they just really want to park somewhere for a while. But a lot of people want to be with the person who takes the times that's necessary, not necessarily the quickest surgeon, but the one that's doing what's right for that person every time that they're in the room with their patient.
And when you see a problem or a challenge in front of you and you can approach that with confidence and make a plan and have a backup plan and once people can see that, then as a leader, it becomes, it becomes second nature, but it becomes second nature for the team, right? Because once they see that, then that opens the door for everybody on the team to start evaluating, here's what the plan is, here's what we're going to do. And we do that in the operating room a lot between both of us. We sit down and say, okay, here's the fracture. This is a bad motor vehicle accident, broken femur, tibia, knee ligament injuries. Here's how we're going to address it. This is the plan for where we're going to go. If this happens, then we're going to do this. And then all of a sudden your whole team is ready to march into battle. And that part I think is, if you're like, holy moly,
prioritize and execute.
Taylar, what do you think about this one? Mm-hmm. There's value in
collaboration,
in collaborating, but there's a strength and contagiousness in that confidence that you know what you're going to be doing.
Absolutely. I can't tell you how many times when I'm in clinic, I say, hey, I know you saw me today and this is my plan going forward. I'm going to show, Dr. Piefer's going to look at your x-rays, or he's already reviewed your x-rays or your MRI and he agrees with this plan, because that just shows it's not a lack of confidence on my part that I don't know what I'm doing or that I'm not confident in my call, but it's more of a showing that I collaborate with my supervising physician, because I believe that that's the best practice of
100%.
Yeah, I think that leads to the best outcomes for our patients, because if I would be lying if I never said I missed something, right?
Yeah. And everybody has that.
Right. So I feel like that collaboration is really helpful, but
when you hear those claims like, I've never had an infection, I've never had a complication, I've never had this, right? That's the time. as a patient or an employee. Run away.
Yeah. That's why I tell them, if anybody ever tells you 100% like guarantee, that's an automatic red flag.
Right.
If they tell you,
No doubt.
with 100% confidence that they are going to resolve your issue with surgery, I would get a second opinion.
Yep.
Always.
Yeah.
So cool.
I agree. And there's a confidence behind that too. There's a confidence. There's a level of confidence in saying, I'm happy for you to get a second opinion.
Absolutely.
Go find somebody else, and right, it's your body, it's your knee, it's your shoulder, right? Once we stick a scope in there, or once we put a joint in there, we can't ever undo that. If you want, right?
Yeah.
And that is, I mean, I think that is actually a pretty direct opposite of arrogance, right? Like the arrogant answer is, I told you what you need. If you don't want to get it from me, then don't get it from me at all.
Yeah.
Go to somebody else, right? As opposed to, like if you're going to go get a second opinion, you may as well not come back, right? That's arrogance versus a confident person who says, we're going to offer you a level of service and a level of care and a level of expertise that I'm confident you're not going to find anywhere else, but I'm happy for you to go search for it. And if you find somebody else, and the other thing is, to be honest, like there are people who are like, maybe we didn't vibe. I didn't get everything that I wanted out of that, and I'm going to go someplace else, and they'll be happier where they are. And if you as a surgeon are like, good riddance to them, like you should really say, great. That's another person who's better in the world, right?
Absolutely.
So
when I go even a step, I'll tell people, hey, this is what you have going on. This is the recommendation I have here. If you're going to get another opinion on it, these are the people I would personally recommend in the community or in the surrounding area that I have enough expertise in this field, in this specific field that your issue's in, that you should seek that opinion from if you want it, right? If you want to, especially something that's not done as frequently, things like hip arthroscopy or complex shoulder procedures, things like that not everybody's doing.
Right.
You don't want to go get a second opinion on somebody about whether or not a hip should be scoped from somebody who doesn't
scope any hips,
doesn't ever do hip arthroscopy, right? Because that's gonna be a total hip arthroplasty to them all day long, right?
And that's where that's where confidence comes from experience, right? Confidence comes from having those numbers under your belt. I agree.
Cool.
Very nice.